good afternoon, good morning, and good evening, wherever you are. I'm very happy that today we are sharing with you the new health product management template that we will be using in the GC8 grant. Before we start, there are some instructions here in case you prefer the simultaneous translation. So please follow the instructions that are here on the screen for you. Ping quickly if there is any question or if you have any difficulty. We have the team here that will help you with technical support. Are we all good? I guess. Yes. Thank you. Thank you for the thumbs up. All right. The agenda that we will cover today. So we are going to give you a little bit of a general overview of the preparations for the GC8, and we are all aware that we are not going to cover everything about GC8 preparation in this session, but we are going to focus on HPMT only. But you do know that there is a lot of information published in our website, and there are other information sessions that cover different parts of the GC8 preparatory work that you can refer to. And if you still need guidance, you know where to reach us. You have your country teams, HPM specialists that support you, that you can always reach out for clarity and for any question that you have to guide you in the process. So we will cover first the health products list for the focus countries. And why we are going to bring that perspective first is because we want to let you know that that is a much simplified and straightforward process that we have developed for this category. And then invite participants, if they want to continue to stay in the session to see what we did with the online HPMT, you're more than welcome to stay. But if you don't want to, then you're free to go. That's up to you. But we will cover that first. We will continue then demonstrating the HPMT, how that looks like. So Emily is going to give us a quick overview and she will guide us through the steps. Be mindful that we are going to have video guidelines and published guidelines in written and in different formats, whatever is easier for you to digest the new information that is supposed to help you go step by step once you start using the HPMT for your GC8 planning. We will also guide you through the steps that are needed to take in the partner portal, resources that I'm mentioning that are available then for your reference. And we will try to go as fast as we can through these points. So then we can leave some space for questions and answers at the end of the session. So please bear with us until then. But then while we present and guide you through the HPMT, you may also post your questions in the chat, and then we come back at the end of the session and we try to answer one by one. Whatever is left unanswered, because of the time that is limited, we are going to take a serious look and then get back to you. But we will also use this feedback that we get from you to add those questions and answers in the guidance notes that we will publish after this session, soon after the session. So feel free. And but also be patient because we think that we will try. We have organized a presentation in the way that we will cover all the key points that you will need to familiarize yourself with the new HPMT. So let us continue. Let us continue with the presentation. Next, please.
Sure. I saw a few comments in the chat about simultaneous translation, so maybe we can just go back just for a moment, so that those in the chat can see the instructions here. And I think a photo of the slide has been pasted in the chat as well. So Benoit put in the chat that there are instructions of how to access the simultaneous translations. So with that, thank you, Darden. We'll move forward.
Great. Thank you. Thanks a lot. So I want to mention that this was a very exciting journey in the last year that has led us to elevate our template and the work that it was Excel-based before. And you are very well familiar with the HPMT that we had, that we still have in use in the GC7. But for the GC8, we had a great collaboration between different teams here that helped us to elevate from an Excel-based template to an online platform that I really hope that you will like it, because we are very thrilled to share that with you today. So this collaboration was across different teams at the Global Fund. But also we had consultations with selected PRs into making sure during user testing that we are getting the feedback and that our template is going to become as user-friendly as possible. This is not the end of the journey, it's just the beginning, because we are ambitious to improve the HPMT further by integrating into the platform other features that will help us also to monitor the implementation. But right now we focus on grant making in the funding request submissions and what we need to accomplish until the end of the grant making process, so then we get good grants, sign on time, and then we start implementing. So in this process that we went through together, I would like in particular to thank very much Patrick Gitendu, Emily Hatt, and Atul Kulkarni for being the brain and the engine behind this work. So they were the ones that never gave up and worked extra hours for many months to have the product that we have today and that we are sharing with you. So you are probably getting familiar. Let's continue, right? So you are probably getting familiar with the GC8 requirements and the resources that are available to guide you through the new grant cycle. But in short, the objective is to have sustainable program design and effective transitions through new strategic shifts, which I hope you had the time to get familiar with. This will require strong applications and timely grant signing within compressed time. Is, I think, the shortest timeline that we have this time to complete this process, but we are also much better equipped than before. And for that, we need online management and improved data quality through the partner portal. For today's session, we are going to cover these last two boxes as highlighted there. But nevertheless, I'd like to remind ourselves of the fundamentals that no matter how the design of the new grant changes, guidance, templates, whatever the new things are going to be introduced, let's not forget that the basic principles remain the same. So we still need to start from the national targets and the strategy that nationally you want to follow, and then to decide what is the global fund portion that is going to cover your national needs and your national targets. And in that, you then need to translate those targets in the health products that Global Fund is going to fund. And once you do that, you will have to define the budget that you need to reach these targets for the operations, for programmatic support, governance, and all the rest. So we will continue to do this as before. This was at the beginning of the Global Fund, and this remains also the key principle that guides us through any grant cycle. So in the GC8, we are not different. We still have to do the same homework as before. Targets, quantification, budgets. But for the GC8, we have we have different application approaches or pathways that you probably had the chance to discuss with your colleagues at the country level. So there are key application approaches. That one is program continuation, the classic submission of the grants and of funding request, and those that are grant ready. So there are nuances to which one is more suitable for your country context. And that was something that you need to decide at your level. And you probably by now, at this stage that we are talking, your country has decided which application pathway they are going to use. Now, this is in this context, let me say, the requirements for HPMT are slightly different. The requirement is different if you have program continuation and grant-ready grants, funding requests submitted, or if you are going to go from a classic submission, or if you are a focus country, then you have a different pathway to follow. So I will try to simplify this. The HPMT is needed at the funding request submission if you are going to opt for program continuation or if your submission is grant ready. So at the funding request submission, you need to have a completed HPMT. If your submission is going to follow the classic pathway, and this is mostly applicable in the context when the new PR will be needed to come on in the picture. The platform to fill the HPMT will not be able then to be open and able for the new PR to fill in the information, because the new PR needs to be selected, it needs to be capacitated, onboarded, and all that. But the funding request needs to be submitted. In that case, you will have to use your tools that you have to decide on the budgets, and you will need to provide the lump sum amount for cost categories 4 to 7 in the detailed budget as a temporary budget indication. So then at the funding request level, at least we know what is the estimated amount that you want to invest in health products. And once you go through the TRP, the portal is open, and then the PR is nominated, you go and you fill the HPMT. But for most of the scenarios, we are expecting to have grant-ready submissions, and that's when the HPMT, for repeated PRs, the HPMT will be required at the FR submission. Now, for the focus countries, it's a simplified process. Like everything else, also the submission for the health products information will be simple, and it will be indicated only in the finance detailed budget template. So this is why we wanted now to focus first on what are the requirements for this category, and then we will go into demonstrating the online HPMT for the rest of the session. So let me go quickly. What is needed for the focus portfolios? So the list for the focus countries is designed to simplify the health product information that will go into the budgeting for the focus grants. It is required to be indicated only in the budget for all submission pathways. And the supporting documents that you need to provide, that remains the same. But how you input the information, it's much more easier. And then we can go into the new slide. So you see how this looks like. So you probably are familiar with a design because it's the detailed budget template. So there you are going to have a separate sheet that is called HP list focused. So only portfolios that are considered focus need to use this tab. High impact and core portfolios should not touch this tab. So in that section, you need to add the health product information in the relevant section. If it's HIV, TB, malaria, you will have to indicate the procurement channel. For the HP data granularity, you need to agree and discuss with a country team and with your respective HPM specialist at what level of granularity you want to present the information of key products, of products that may be like consumables and others that may come as a lump sum. But whatever is relevant in your context, you agree with your country team, and then you start populating this sheet. The same will be then for the PSM cost. They are lumped into one indicative percentage per procurement channel that cover upstream and in-country supply chain costs and quality assurance. And then you have the total budget. This total budget that is in this sheet will then have to be cut and paste and put into the summary budget for the categories 4 and 7 as in the non-HP. You will have that in the guidance. Don't get confused now. It's much simpler than it sounds. So please bear with us. And in the remaining of the session, you will see why the budget categories for the health products, that is from 4 to 7, can only be inputted when you extract the HPMT detailed budget and is automatic, and then it's copied into the detailed budget. Everything else, which I'm coming now to the countries that are submitting the classic grants and focus countries, they need to do this manual work in Excel. So I hope this is clear, but this is basically the sheet. It's straightforward, it's intuitive. But we are happy now to take any quick questions that you may have now, only specific to focus countries, before we continue introducing the HPMT that is in our partner portal. Okay, we already have some questions coming. I'm sorry because I'm presenting. I'm not looking at the chat box right now. Yeah, HPMT is needed for CCM budget. CCM budget is not meant for procurement of health products. Okay, I am not very clear about this. Megan, go ahead, please.
Thanks. Sorry, if I could come in. I think this is referring to the CCM investment priority request submission pathway. And that is a submission pathway that is available to certain focus portfolios. And since focus portfolios do not generally do an HPMT, there's no HPMT required for that submission pathway. I hope that answers the question.
Thanks, Megan. And just to say, it is covered under the focused scenario. So here you can see for all focus portfolios, and that includes the investment priorities. They will need to complete this tab in the budget, the HP list focused. Thanks. I'm not sure if we have any other questions right now on focus portfolios. So maybe we'll just give it another minute to see if there's any other questions regarding focused. And then if not, we can say goodbye to our focus colleagues if they wish to drop. And we can move forward to explaining the online HPMT for our high impact and core colleagues. If our focused colleagues want to stay, you're more than welcome, but just to say that this covers the focus section of the presentation. So
and also remember that we will have all this in the guidance guidance that will be published. We had a question, I think, or a hand raised.
I think it was a hand raise, and now it just turned into a thumbs up. So I think we're okay. Yeah.
Okay.
Was there one other, sorry, did you answer that second question, Dardan, about the Excel file? Is
Do
that,
we have-
Yes.
yeah, okay.
Yeah, it will be, yeah, the Excel file you will be able to download as part of the budget template. So again, it's you don't have a specific template only for health products. You are going to use a detailed budget template where you have a separate sheet with the tag HP focused, and that's the one that you will use in the budget template. And again, it's only for the focus countries. Okay.
I think that's it in terms of the questions for focused.
Right. So I think all right, you're more than welcome to stay. You're more than welcome to keep asking questions as we progress with the session. But now we are switching to high impact and core portfolios, and I will hand over to Emily to guide us through the process. First, on the benefits that we see that new HPMT is going to bring in this new grant cycle, and then guiding us through in the steps that you are expected to follow once you log into the platform. Over to you, Emily, and thank you everybody again.
Thanks, Dardan. So as Dardan said, I'll take you through the online HPMT, which is for the high impact and core portfolios. And if you do have any questions as I go through, please feel free to add them to the chat, and we'll have another question and answer period at the end where we'll address all your questions. So here are some highlights of the new online HPMT. So we've noted that there's improved user experience. It's integrated with the Global Fund systems. It provides improved visibility as well as a simplified budget calculation. And there are some built-in data quality checks. So these are all elements that you'll see as I take you through the demo today. So just digging a little bit more into detail about these different benefits and different aspects of the online HPMT and what that means. If we zoom in on the orange section, the improved user experience, and you'll see this once I bring up the online tool, but you'll see that the tool is now built in a way that almost resembles like a shopping cart if you go onto an online site. So you have the full catalog of products that you can click and you can add to your selected products list. So we feel that the tool is intuitive to navigate, and it includes different filtering options, which makes it user-friendly, allows for quick edits, and also the form as you go through, it automatically saves. So moving to the simplified budget calculation. So this is something that we worked to simplify from the Excel to the online tool. So now the budget is calculated by, you can see here, you select different interventions based on the product category. And then for each intervention, you put a percentage of the planned cost for that product category. So again, this is something I'll dive into further when we go through the online demo. But just to say that now we feel that there's increased visibility for you, the PR, as to how the budget lines are calculated. And you also get to make adjustments if you want to add or remove any interventions. Zooming into the green and purple areas of the infographic, we have integration with the Global Fund system. So because the HPMT is now online, it's integrated with the most recent product list from our product data hub. So if there are any changes to any products, this is automatically reflected in the online HPMT. As well, it pulls in all of our reference prices and lead times. So you will see that data again once we go through the demo. And there's also improved visibility in the Global Fund system, thanks to having this online and being able to integrate it with our other systems. So last, another thing to note, and if you also have been working in implementation oversight and PR reporting, this is something that will be familiar to you. but we've built in data quality checks as part of the online HPMT. So there are 3 different types of data quality checks. Previously, there were only 2. Now we're moving to 3. So there are warnings, critical warnings, and errors. So if you have a warning or a critical warning in your online HPMT, this will require you to either correct the data or to provide a comment in a comment box in order to proceed and submit it. Now, if you have an error, the error will not allow you to submit until the error has been corrected. So for that one, you'll have to correct the data in order to proceed. And again, all this information will be included in a user manual that we'll be publishing. We'll also send these slides after the presentation, and I'll take you through what this looks like in the online tool in more detail. So another important note for the HPMT for GC8 is around the grant entity data. So for GC8, because we are moving online, it may be necessary that new contacts have to be added to the GED. So we have a note here that says, please work with your CT to ensure that all contacts are up to date in GED. So if you have any new PSM or HPM staff from the PR that need to be added to our online systems in order to have access to Partner Portal, please make sure that you do complete the GED. And we have a link here to the instructions about how the GED is added, as well as the available roles. Okay, so moving into the steps in Partner Portal and what the steps for the online HPMT look like. This is just a simplified flow diagram of what the process for completing the online HPMT is. So initially, the Global Fund will share the HPMT with you, the PR. And when they do that, the PR will receive an email notification with a link to the online HPMT. So the PR clicks on the link and they go in and they complete the online HPMT and they submit it to the Global Fund. Then it goes through a few different steps. If there's a LFA review required, it would follow this path. If there's no LFA review required, it would go straight to the Global Fund review. We also have the PR copying and pasting the HPMT extract budget tab into the budget. So this follows the procedure that you followed today for the Excel, where that one page is copy and pasted into the budget. And then the Global Fund will confirm and approve and review everything, and then the HPMT will be approved. So our session today is focusing on these PR steps. So we'll show you how to complete the online HPMT, how to submit to the Global Fund, as well as how to take the extract, what that looks like, in which tab you're expected to copy and paste. So with that, we'll move into the demo. But in order to do that, I'm just going to stop sharing for a moment so I can get logged in. So Darden, anything from your side before I start the demo?
I see there are questions in the chat, which are lots of them are asking about the product list, if we can add new products or not. Emily covered, but if you didn't pay I mean, it wouldn't harm if I repeat that again, because we are very excited about this this synchronicity that we have worked on here. That the list that is used in the catalog for procurement, the Wambo catalog, the list that is used for eligible suppliers, the QA list, and the list that is in the HPMT is automatically updated. So every time you open the HPMT, the data will be pulled from our product data hub, and you will have the latest list that is there with all the features that you need to have for that product. So you will see that once we go into the system, how that looks like. The product characteristics, you will have the reference price, you will have the lead times, and we will maintain that so it will be automatically synchronized with the HPMT whenever you will use it. Over to you, Emily, if you are ready to continue. Yeah.
Perfect, ready. Thank you, Darden. So I'm sharing my screen again. Please let me know once you can see it. It's all good. Yes, perfect. Thanks, Benoit. So let me go to the home page of the partner portal and we'll start from there. So this is the home page of the partner portal. And again, this is just a fake account, a user account that we use for testing. So what you see here are more grants than would typically appear in your normal homepage. But again, this is just for demo and testing purposes. So when you log in as a PR, you see the principal recipient reporting section, a grant making section, and a section on grant revisions. Over here to the right, you'll see something called My Applications. This is where you will find the HPMT. It's not listed here currently because it hasn't been added to your favorites. So what you'll do is you'll click on View All, and you'll scroll down and you'll see the new app called the Health Product Management app. So if I click on this star, this will then favorite it so it shows up on my homepage anytime I sign in. But I can click on the app here and it will open in a separate tab. And you'll see all the different cards that are associated with your account and the different grants. So again, because this is a demo, there's more than what would usually appear. But for the purposes of today, we're going to use this Togo grant. Togo grant that is a tuberculosis grant. So you can see the different status here. This one has been shared with PR, but the PR hasn't clicked on it yet. Whereas once you click on it and you start working on it, it will change to PR to complete and submit. So I'll go ahead and open it. And this is what the online HPMT looks like. So you can see here at the top, there's different grant information. You have your geography, the status, the IP starts and end dates. You also have the overall status here of the online HPMT. So if it's with you, the PR to complete and submit, if it's been sent to the Global Funder for review, or once it's been fully completed. Now, clicking this little arrow here, you can collapse this section to give yourself a little bit more working space. So there's different tabs you'll see, and I'll take you through each one of them sequentially. And this is how you complete the online HPMT. You go through each of these tabs one by one, and you follow them in order to complete the HPMT. So in the Setup HPMT tab, you can see here we have a section on years for budgeting. So the years for budgeting should then be aligned with the detailed budget as well as with the performance framework. But if you need to make any edits, if you have a grant that operates in a different cycle than January to December, you can click here to change the dates, and the other dates will adjust accordingly. If you need to add another year to your grant, you can click on the plus button and another year will appear. But the start date and end date will always match the IP start date and end date for your grant. Below, you also have the ability to select a primary procurement channel. I'll show you as we move forward, you're able to select different procurement channels, but by selecting a primary procurement channel here, it defaults the selection everywhere else in the form to that procurement channel, so it reduces the number of clicks, but still gives you the ability to then change the procurement channel later if needed. So for today's demo, I'm going to use Wombo as my primary procurement channel. And then also, because my grant is a euro grant, you can see here the grant currencies in euro, as well as the US dollar conversion rate. So all HPMTs will be completed in US dollars. But you'll see it as I take you through the demo that because this grant currency is euro, there's also summary tables which show you the totals in US dollars as well as in euros. So moving forward to my next tab, I can either click on continue or I can just click on the next tab name. So this takes me to my select product list. So as I said, this kind of operates like an online shopping cart where you would click on the different products that you want and add them to your selected products list. We have filters here. So currently I'm just looking at the amount of products in our list that are relevant to TB, which is 683. But if I click on all, then I'll get the entire catalog, which also includes products that have been tagged for malaria or HIV. So I'm just going to go back to TB. Now I'm going to use these filters to help me select some products. You can see that there's options for pharma or non-pharma, as well as past orders. So once you've actually completed one online HPMT, if you go in later to do a revision, this past orders option becomes beneficial because it will just filter this by what you have previously planned in your HPMT. So for this one, I'm going to click on the anti-tuberculosis medicine. I'm going to add in just a couple, so I can click on both of them, and then click the arrow to add them to my list. I'll clear that filter, and now I'll also select some personal protective equipment. I'll say, let's do a box of gloves. And I'll select one more product for testing, maybe some reagents and test kits. So I'll click on this one. Now, also to say you do have this search bar. So if you want to filter, so if I filter on anti-tuberculosis medicines, I still have 56 products here. I can then start typing the name of the product, and you'll see that it will do it'll narrow down the search. So it makes it much more simple to find the products that you're looking for. So with that, I'll move forward with my 4 selected products. So again, you can click either continue at the bottom of the screen, or you can click on the subsequent tab, which is enter order details. So in this tab, you'll see here at the top, this is one of the products that I've selected. If I click on this arrow, I can see the full list of the products that I've selected, and I can navigate to each one of them by using this menu, or I can use these arrows to navigate back and forth. The name of the product is also repeated here at the top of the table. So for this one, amoxicillin, I will click on the options, and you can see all the available options for the different types of packaging, blisters, tablets, packs. So for this example, I'll click on the pack of 100. You can see that by doing so, the reference price has automatically been pulled in from PDH. So I have the reference price here that's automatically copied into the cost, but it's still editable if I do think that I need to put in a different price. For the need by month, I'm going to say I need it by the end of the year. And the lead time, I'll say 6 months. And in doing so, the order month is automatically calculated. So for this example, I'll say we need 50 packs. Now, if I want to add another order, I can click on this button. Again, I'll select my option. I'll keep it the same for now. For this one, I want to have it at the end of 2028. And I'll say, because I know that sometimes the shipping can change, this one will actually take 8 months. And again, my order month will calculate accordingly. Here, I'll change the reference price just so we can see later what happens when you do so. And I'll add 50 packs. Some other things to note here is if you want to do a bulk order, you have the option to have a staggered delivery. So I can click on this plus sign, and it will give me an option to add another need by date and quantity. So I can do that a few times if I want, if staggered deliveries are more convenient for you to plan. So let me just delete these before I move forward. I'll go to my next product. And again, I'll click on the options. I'll add in quantity, and I'll place my order for, let's say, the final year. I'll click on my order month this time, and you can see that the lead time automatically calculates. So let me add in maybe one more. This one I'll do for 2028 for 6 months. Okay. I'll move forward to my next product. Here, I'll select my product option. Again, I'll add in my quantity, and I'll put in my need by time. Moving forward to my final one. And this one, as it's gloves, there isn't a specific packaging details that are available. So I can write in here which kind of packaging I want. So I'll say box of 100. For my need by date, I'll say I need it by the end of the first year. The lead time I know is usually 4 months. And then I'll put in a cost and a quantity. And as you can see, the the total automatically calculates as well. One other thing to note on this page is this box here, which is specify logistics cost. So if I know that I have a product that has really specific logistics costs that don't really fall in line with some of the other products, I can specify at the individual product level some logistics. So in this case, I'll do that for this PPE. So I'll click here, specify logistics costs, and then I'll put in a percentage for each of these. So I'll just put in 1% as our example. There we go. And as I mentioned earlier, all this is automatically saving. So as I go through, anything that I enter now will be saved, and I can always exit the HPMT and come back to it later. It doesn't have to be completed in one sitting, because all the information as you enter it is automatically saved. So let me move forward to the next screen. So our next tab is review orders, and this is where you get a summary of the different products you have, as well as the years and quantities where you have planned orders. So this gives me a high-level overview. If I see this and I think, oh, I should have actually had some planned orders for year 1 for this product, I can then click on this link, and it takes me directly back to that product where I can enter in another planned order. So moving forward again, you'll also see down here, there's a floating icon of 2 windows. If I click on that, that's going to give me my running total of what I've planned so far in the HPMT. So you can see that there's some logistics cost because I did specify the logistics cost at the individual level. But some other logistics costs will be added later once I get to that tab. The same here for total fixed costs. There's nothing here yet because we haven't come to that tab. But once we do, I'll show you again how this is filled out. So as I mentioned before, because this grant is in euros, we also have the toggle at the top where I can view this summary table in US dollars, or I can view it in euros. So moving forward, we'll go to the Add Logistics Cost tab. And here you'll see that all the products that you have selected show up in different product categories. In order to know which products fit into which category, you can hover your mouse over the eye icon, the information icon, and you can see the different products. So for anti-tuberculosis medicines, I have 2 products selected. Whereas if I move down for the testing kits, I have the 1 product, and same with the PPE, it's just the glove box. So here, for each of these product categories, you'll add in your logistics costs. Because in the PPE one, I have already added my logistics cost at this individual level for the gloves, you'll see that there's already some values here that have been included. So for this example, I'll just start adding 1%. You can see when I added in for year 1, it's automatically then copied to year 2 and year 3. Just to reduce the number of clicks needed, but if I do want to change it, I still have the ability to go in and change that value. So let me quickly fill this out. And I'll change everything here to 2, just so we can see how that works. And I'll fill these ones as well. Okay, and actually I'll delete this one just so we can see with our data quality checks what happens when we leave some blank. You can also see that if you do have planned orders in the year, you will get these numbers calculating as totals. But for this one, for example, I don't have any planned orders in year 1, so there's no value that's been calculated. Only for year 2 is where I had a planned order. So moving forward, we'll now go to the Assign Budget tab. So this is where we had said that we have simplified the detailed budget calculation. So you can see we have the same product categories that you saw in the logistics cost page, and we still have the same information icon so that you can click and hover over and see which products fall into that product category. So for anti-tuberculosis medicines, I'll click on my Add Remove Intervention, and I'll have this pop up. For this pop-up, you can see that there's suggested interventions, which have a green tag, and alternative interventions with a purple tag. So my suggested interventions are ones that have been mapped to the products I've selected, just to give you an idea of, narrowing down that list and making the selection a little bit easier for you. So for anti-tuberculosis medicines, I will click on HIV and TB prevention, treatment care and support, and also preventative treatment for this one. And I'll click Save. Those interventions are now shown, as well as the total planned health product cost for this product category. So now I will enter the percentage of this amount that I feel should go to each intervention. So for the top one, I'll say 30, and then 40, and 30. If I want to enter a comment, I can click on this speech bubble and enter a comment. Once I do so, the color will change, indicating that a comment has been entered. So for the second one, let's say I don't want to use the suggested intervention. I want to use an alternative intervention. Then I can click on this dropdown, which gives me the selection of all the modules and all the interventions. So I'll say for this one, I actually want to use treatment and care, and I'll add it. This gives me the ability to add up to 3 alternative interventions. So let me add one more. For any alternative intervention, which is with the purple tag, a comment will be mandatory, and that will show up as a data quality check. So for now, I'll just enter our percentages, but I'll leave these comments blank, and then you can see later how that will appear as a data quality check. Lastly, I'll select another intervention. If I only select one, then it automatically defaults to 100. Let me change this percentage so it's more than 100, and we can again see what happens with our data quality checks. Okay, moving forward. Our next tab is to add fixed costs, and you'll also see here we have a list of other implementers. So if I click on this, this is where I can add any sort of other implementers, such as a subrecipient. So for the example, I'll say the name is SR1. That will also be my acronym. The type is the subrecipient, and then let's say it's a CSO, and that will be it. So I'll save that. And when I add my fixed cost, I click on this blue button, and I say what module, intervention, and cost input my fixed cost should be affiliated to. So let me say anti-tuberculosis medicines. So once this has been selected, then I can put in my description of the activity. I'll select my implementer. So my PR in this circumstance is SGG, but I'll click on my subrecipient one. I'll select my procurement channel, and then I'll put in the cost. So let me say 100, 200, 300. Again, I can add another fixed cost. I'll select RSSH, program management, and I'll add that to my other PSM costs. Activity 1. And for this one, I'll say UNDP, just for an example, and I'll enter my fixed cost. Now that I've done that, I can click again on these floating windows, and you can see, because we've added cost everywhere, the entire table is populated. And again, I can view this in US dollars or in euros. On the next screen, moving forward, is the budget overview. So this gives you a summary of everything that you've planned based on each module that you've selected. So I can see here a breakdown of each. So this is the second to last tab in the online HPMT. So if I move now to our last tab, which is the review and submit tab, this is where I can actually complete my data quality checks, as well as download the extract, the online form, which is needed to copy and paste the information into the budget. So here you'll see Errors and warnings, this is our data quality check section. And if I try to go ahead and submit the form without running the data quality checks, the system will not let me. So let me just click the button, check data quality, and we can see what appears as our data quality checks. So here at the top, you'll see that there's a banner that there have been some errors or warnings. The table tells me there's 4 warnings. For the first one, it says the unit price deviates from the reference price, so either update the unit price to match or provide a justification. If I want to go back and see where this is applicable, I click on the tab. I can click on highlight mandatory fields, and it will show me if any information is missing. So there's no information missing here, everything was filled out, but I do have a price that deviates from my reference price. So because I entered this and I know that my price should be different, I'll say, okay, this is fine. I can go back to my review and submit tab, and I can add a justification. For the next one, you can see mandatory information is missing. So I want to click on the tab and highlight the mandatory fields. You can see here that I didn't enter a percentage for each year for this logistics cost. So even if it's 0, we need to add in a 0. So in doing so, I can go back to my review and submit screen. And now I'll just click the check data quality button once again, and this second one should disappear. Great. So now that that one's been resolved, I have 2 more remaining. They're both in the assigned budget category. So one of them says that the percentages entered must add up to 100. So I'll click on that. I'll highlight my fields, and it shows me that I have an error here because this doesn't add up to 100%. So I'll make the adjustment that's needed. And I'll go back to my review and submit screen. And then lastly, it says an alternative intervention has been selected. Please provide a justification. So if again, I click on the link, if I click on the mandatory fields, it highlights these comment boxes for me in red, which means I must provide a comment. So I will do so now. Comment 1 and comment 2. Again, once these comments have been entered, the color of the speech bubble changes to yellow, so I know that I've entered a comment. So now that I've addressed all of my data quality checks, I'll click the button one more time just to make sure. And the only one remaining has been justified, so I get the green banner which says my data quality checks have been successful. Here, you'll see that I can have a space as the PR to provide any other further comments. So I'll enter my comments here. I also have a space to attach any supporting documents. This is not mandatory. You can submit without attaching them, but if you do want to attach some documents, you have the space here. And then lastly, to note before we would submit to the Global Fund is on the extract. So here's the button to extract the online form. So I'll click that now. You'll see the error glass appears, which means it's downloading. And in just a moment, we should have that available for us. Dardan, anything on your side you want to point out while we're waiting for the extract?
Yes, there are questions about the LFA. While if LFA has access to the template, the LFA does not have access to the portal. That's why all the communication between the Secretariat, the HPM in the Secretariat, the PR, and the LFA is going to be offline. So this is why you extract the HPMT, or we do that from our side. We send it to the LFA for review. The LFA will review the extract that we will show you, and then will come to you or to the country team and to you with the recommendations how or where the changes need to be made. And then you will sit and make those changes, or if they are immaterial, very small, the HPM specialist can do it here for you and let you know where the changes were made. But because you are the owner of the HPMT, you need to make the changes in the system. So the LFA will not be able to do that for you. You need to do it for yourself. And you will see now how the extract looks like. Yeah, you have it up, Emily. So
Yeah.
let's show the extract.
Perfect, thank
But
you.
the key thing to remember is that LFA will not have access to the platform.
Perfect, thanks, Darden. So this is the extract. So it's an Excel file, and it follows, you can see the different tabs here. They follow the same tab name as what's in the online HPMT. So you can see all the information that you entered in the online HPMT is available in the extract. Just to note that you can take the extract at any time, and it will show you any information that you've entered. So if you want to take the extract initially when you log in, this will be blank. You can use it for offline collaboration, but it cannot be imported back into the system. So any information that you change in the extract, you'll then have to do the changes in the online system. But if it's helpful to use for collaboration, please feel free to do so. So we have the different tabs here. Again, they follow the same tab names as what's in the online HPMT. But as you move forward, you'll see there's a summary of data quality checks. And then there's also this tab called your budget HP tab. So this is a tab that will be copied and pasted into the budget, which includes all the different lines, and it follows the exact same format as you have in the budget. So you don't need to make any changes, you just copy and paste. Also, this tab is locked, so it will prevent you from making any changes. So if you do need to make changes, you make them in the online tool, and then you would take a new extract. Just to finish off, there's also a few pivot table tabs here. In case you want to do some of your own calculations, you do have these as kind of free space to navigate. So that's the extract. Once you have that, then we're ready to submit. I can scroll down and I'll click on the button Submit to the Global Fund. I'll stop before doing that right now, just in case we do have questions that come up in the question and answers that may be beneficial for me to be able to navigate back and show you some further details, because once I submit to the Global Fund, this becomes read-only for the PR and I won't be able to make any further changes. So let me just pause there for now. I'll stop sharing and then we'll go back to the PowerPoint. So let me just switch over. Okay. And so we just had a few key points to remember before we go into the question and answer period. So like I said before, there's automatic saving in the online form, but it also allows editing for multiple users. So any data that you enter is automatically saved. You can leave the HPMT and come back to it. You don't have to complete it in one sitting. And there's also a benefit of multiple users can access and edit the HPMT simultaneously, but please do note that we see this as a little bit of a risk, because if two people are editing the same data, there's a risk of them overwriting each other's information, and it can also cause a delay in some of those calculations that you saw in the summary tables. Also, as I mentioned before, the HPMT will be completed in US dollars. So all the HPMTs are completed in US dollars, and Euro grants will have the totals in the summary tables. Catalog updates, we mentioned this before, but if there's any new products that appear in our catalog, they'll automatically be synced to the online HPMT, or if you've selected an item that has since been discontinued, this will be caught as a data quality check. And lastly, around the extract, this can be taken at any time. Again, if you make any edits to the extract, you'll then have to make the edits as well in the online system because you cannot import the extract. A few more key points. So the visibility, when the HPMT is being completed by the PR, the Global Fund cannot see the information until it's been submitted. And once it's submitted, the PR can only see a read-only version of the HPMT. Once it's been completed and submitted, there is the ability to revise the approved HPMT. So you will have both an approved version and then a draft version. So you can work on your draft version, and the data from the approved version will not be replaced until this new draft has been approved. Supporting documents, I showed you that there's a section where you can attach documents. So again, this isn't mandatory in order to submit the form, but if you do want to add documents, you do have the space to do so in Partner Portal. And then when we were presenting this before, we had some questions around multi-component grants. There was some confusion about whether one HPMT should be completed per component, but it's 1 HPMT per grant because the HPMT informs the budget and is copy and pasted into the budget, and there's only 1 budget per grant. So even if you have a multi-component grant, there'll only be 1 HPMT. Some resources that will be available. So we have some links that are already there. Again, you'll get a copy of these slides. There'll also be a recording that's published, and these other materials on system guidance. Once they are ready, they will also be published to our website, and we'll make sure that you're aware of when that happens, and that also, all the links are ready and provided to you. So we'll have a manual. We'll also have some infographics. And what I've shown you today in a live demo, we'll make some other videos that will be uploaded to YouTube, so you can go in and reference those videos at any time.
All right. I think we can thank everyone for your patience and for your participation in the session. And thank you very much. And good luck with GC8 preparations and submission.